Varicose veins of the lower limbs are dilated and twisted veins in which blood flows in the wrong direction against the normal flow. These reverse circulation result from the failure of venous valves, which are responsible for the return of blood to the heart. As a consequence, the vein dilate, the walls weaken, and venous return becomes inefficient. There are two main types of varicose veins: primary varicose veins, which are the most common type and are not caused by any underlying pathology, and secondary varicose veins, which are less frequent. They are usually associated with conditions such as deep vein thrombosis or venous malformations. Varicose veins of the lower limbs affect about 30% of the population. They can occur at any age, though their frequency increases with age. In addition to their high prevalence, they have a significant socioeconomic impact. Let's have a quick anatomical overview. The venous system of the lower limbs consists of two distinct networks, the deep venous network and the superficial venous network. The deep venous network follows the arteries and it's located deep within the tissue. However, the superficial venous network, found just under the skin, it includes veins such as the great saphenous vein and the small saphenous veins and their collateral veins. These veins become visible on the surface of the skin, especially when they are dilated or varicose. The superficial network drains into the deep network through the saphenous junction, or what we call ostium, which is a junction where the superficial veins connect to deep veins, and through also perforating veins that allow blood to flow from the superficial network into the deep network. When venous fails, venous incontinence occurs, leading to venous overload. The consequences are blood stasis and venous hypertension. When blood stagnates in the vein, that can lead to various complications. First, the formation of venous thrombosis, or blood clots in the vein. Secondly, trophic disorders affecting the skin and subcutaneous tissues, causing dermatitis and venous ulcers. There are so many predisposing factors that can increase the risk of developing this condition. Female sex. Women are more likely to develop varicose veins. Hereditary and familial predisposition. Family history plays also a role in the risk of developing varicose veins, and jobs or activities requiring long periods of standing increase the risk. Some other aggravating factors are heat and humidity. Conditions such as hammam and saunas can worsen vein dilation. As we said before, some professions like hairdressing or surgery, which require prolonged standing, increase the risk of varicose veins. Pregnancy can also increase the risk, as hormonal changes and fetal pressure on pelvic veins promote varicose vein formation. Next, endocrine disorders. Factors like obesity, contraceptive pill use, and other hormonal imbalances can worsen venous stasis. And finally, sedentary lifestyle and intense sport. A lack of physical activity or conversely excessive sport practice can disturb blood circulation and contribute to varicose veins. We will talk about positive diagnosis, clinical exams, and treatment for this condition in the next video. If you have any questions, please leave them below. Thank you so much for watching till the end, and I'll see you in the next one. Bye bye.